What if something as ordinary as your daily shower could quietly raise your risk of a stroke overnight? Imagine waking up one morning unable to speak clearly, with blurred vision, or unable to move one side of your body. Could the way you shower really be putting your brain in danger? In this video, you're about to discover 5 common shower habits that doctors warn can trigger sudden, dangerous changes inside the body. Changes that may dramatically increase stroke risk, especially for people over 60. We all know the usual suspects: smoking, high blood pressure, poor diet, lack of exercise. But medical researchers are uncovering something far more surprising. The way you shower can quietly betray your brain and circulation. So stay with me until the end. Some of these habits, especially the 4th one, may shock you, because what feels soothing or refreshing could be quietly undermining your health and independence. Now, let's begin with the first hidden danger: very hot showers at night. 1. Very hot showers at night. Many people think a hot shower before bed helps them relax. It feels great after a long day. The hot water feels good on tired muscles, the steam fills the bathroom, and you feel sleepy afterward. But very hot showers at night can hurt your brain and blood vessels, especially as you get older. Here's what happens when you take a very hot shower. The hot water makes your blood vessels get bigger very fast. When blood vessels suddenly get bigger, your blood pressure drops quickly. Sometimes it drops a lot. Your body does this to cool you down, but when the water is too hot, this can be dangerous. When you're young, your body can handle these changes easily. Young blood vessels are flexible and can bounce back quickly. Your heart and blood vessels work together to keep blood flowing to important parts like your brain. But as you get older, your blood vessels get stiffer. They can't adjust as easily to sudden changes. Your body that used to handle hot showers just fine now has trouble keeping up. A sudden drop in blood pressure at night can be very dangerous. Your brain needs blood with oxygen to work properly. If your blood pressure drops too much, your brain doesn't get enough blood. This makes strokes more likely while you sleep. At night, your blood pressure naturally goes down a little bit anyway. When you add a very hot shower right before bed, your blood pressure can drop too low. This means your brain might not get enough blood while you sleep. This is even more dangerous if you take blood pressure medicine. Hot water works almost like taking extra medicine you don't need. It makes your blood pressure go even lower than it should. Your medicine is made to work perfectly with your body's normal schedule. But a very hot shower messes this up. This creates big problems. Your blood moves slower, your blood vessels are stressed, and if you're older or already have health problems, this puts you in real danger. Hot water also changes how thick your blood is. When you combine this with blood vessels getting bigger and blood pressure dropping, blood clots can form more easily. Old clots can also become more dangerous. The tricky part about this habit is that it feels so good when you do it. You feel relaxed and comfortable. This hides the fact that you're actually stressing your heart and blood vessels. Many people feel dizzy or lightheaded after very hot showers. Most people think this is normal, but it's actually a warning sign that your blood pressure dropped too much. Instead of taking these risks, keep your evening shower warm but not burning hot. Your skin should feel good, not red or like it's burning. Taking shorter showers also helps because being in hot water for a long time makes the blood pressure problem worse. After any warm shower, drink a glass of water. This helps keep your blood volume normal and helps your heart and blood vessels control your blood pressure better. What feels relaxing can actually quietly hurt your body's most important system. And hot water isn't the only danger. The timing of when you shower can also be risky. 2. Showering immediately after meals or medication. Many people shower right after dinner or taking their evening pills. This seems normal and easy to remember. But this timing is very dangerous for your brain and heart. Your body works like a water system, moving blood where it's needed most. When you eat a big meal, your stomach needs lots of blood to break down the food. This means less blood goes to your brain and other parts of your body. Usually, this isn't a problem because your body knows how to balance things. But when you take a warm or hot shower right after eating, you create a big problem. The hot water makes blood rush to your skin to cool you down. Now your body has to choose: send blood to digest food, cool down your skin, or keep your brain working properly. The result is scary. Your brain doesn't get enough blood with oxygen. This happens slowly and quietly. You won't feel chest pain like with a heart attack. Instead, you might feel a little dizzy or tired, but most people think this is normal after eating. Taking medicine makes this much worse. Blood pressure pills are made to slowly lower your blood pressure over time. But when you add eating and then hot water, your blood pressure can drop too low too fast. This puts your brain and other organs in real danger. This creates the perfect recipe for blood clots. When blood moves slowly and your blood vessels keep getting bigger and smaller quickly, clots can form easily. These clots can travel to your brain and cause a stroke. The scary part is that this feels fine when it happens. You feel relaxed during the shower. Your body gives you very quiet warning signs that are easy to ignore. You might feel slightly dizzy, a bit tired, or just not quite right. Most people think this is just normal tiredness after eating or a side effect of their medicine. The danger is real, but the solution is simple. Wait at least 1 hour after eating a big meal before you shower. This gives your stomach time to do most of its work and lets your blood flow get back to normal. If you take blood pressure medicine, heart medicine, or even common drugs like allergy pills, give your body time to get used to them before showering. Most medicines start working strongest within 30 minutes to 2 hours after you take them. Showering during this time can make their effects much stronger than they should be. When you must shower in the evening, use warm water instead of hot water. Your body can handle small temperature changes much better than big ones. Warm water still cleans you and feels good without putting dangerous stress on your heart and blood vessels. Remember, what feels relaxing and normal can quietly hurt your body's most important system. Small changes in your routine can save your life. What seems like a harmless time saver can quietly pull the rug out from under your brain. And if you think this is the only hidden danger, think again. Even standing too long in a steamy bathroom can create the conditions that push your brain to the edge. 3. Standing too long in a steamy shower without ventilation. A closed bathroom filled with steam may feel soothing, but it can create a dangerous environment for the brain. As hot steam builds up in a poorly ventilated bathroom, the oxygen level in the air drops. At the same time, hot water forces blood vessels to expand, lowering blood pressure. When these two effects combine, low oxygen in the air and unstable circulation in the body, the brain is placed under severe stress. The danger is greater for older adults. Aging arteries are stiffer, and the brain depends on steady oxygen and blood flow to function. In a steamy, unventilated bathroom, blood thickens as circulation slows. This makes it easier for clots to form, which can block an artery in the brain without warning. The risk is silent. You may not feel pain. You may not notice the oxygen drop. But the brain is struggling, and damage can occur in minutes. What to do instead? Always ventilate your bathroom during showers. Keep a window open or run an exhaust fan. Limit the time spent in a hot, steamy shower. The longer you stay, the more oxygen levels fall and the more unstable your circulation becomes. Take breaks if needed, step out, breathe fresh air, then continue. A bathroom filled with steam is not harmless. It can quietly rob your brain of oxygen and create the very conditions that trigger a stroke. And if heat and steam can be this dangerous, imagine what happens when the body is shocked by sudden cold water first thing in the morning. 4. Sudden cold showers, first thing in the morning. Cold showers are often promoted as healthy, energizing, and even therapeutic. But for older adults, a sudden icy shower in the morning can be dangerous. Here's why. When freezing water hits your skin, blood vessels constrict instantly. This is the body's natural defense against cold, but the effect is extreme. Arteries narrow and blood pressure spikes sharply within seconds. For someone young and healthy, the heart can usually handle the sudden surge. But in people over 60, with stiffer arteries and weaker circulation, that rapid spike can strain the cardiovascular system. The intense pressure can damage fragile blood vessels, and when vessels are injured, clots are more likely to form. Once a clot travels to the brain, the result can be catastrophic. The risk is especially high for those with hypertension, high cholesterol, or a history of vascular disease. A shock of cold water doesn't just wake you up, it shocks your heart, your arteries, and your brain. What to do instead? Avoid sudden cold plunges if you're over 60 or have cardiovascular risks. If you want the benefits of cooler showers, start with lukewarm water and gradually reduce the temperature over time. Ease your body into cold exposure rather than shocking it instantly. What feels like a burst of energy can actually be a dangerous surge in blood pressure. And if the morning cold shower is risky, the timing of nighttime showers can be even worse, because your body is already at its most vulnerable. 5. Showering too late at night before bed. Many people love taking a shower right before bed. The day is done, the house is quiet, and warm water feels like the perfect way to get ready for sleep. It seems like a great idea to wash off the day and feel clean before getting into bed. But showering too late at night can quietly create the perfect conditions for a stroke while you sleep. Here's what your body does at night that makes late showers dangerous. When it's time to sleep, your body naturally makes your blood pressure go down and slows down your blood flow. This is normal and helps you rest. But when you take a hot shower at this time, you make your blood vessels get even bigger, which pulls more blood away from your brain. Your brain needs steady blood flow to stay healthy, especially at night. Showers also make you lose water from your body through sweat and steam. You might not notice it, but you're getting a little dehydrated. When you combine low nighttime blood pressure with losing water from your body and slower blood flow, your blood gets thicker. Thick blood is more likely to form dangerous clots. Think of it like this. Your blood is supposed to flow like water through a straw. When it gets thicker, it's more like trying to drink a milkshake through that same straw. It's harder to move and more likely to get stuck. In your body, when blood gets stuck or clots form, they can block the blood flow to your brain. This is what causes a stroke. For older people, this becomes even more dangerous. As we age, our blood vessels aren't as flexible as they used to be. The brain is already more at risk during sleep because blood flow naturally slows down at night. This is normal, but adding a late hot shower makes everything worse. It pushes your body into a dangerous state where stroke becomes much more likely. The scary thing about strokes that happen during sleep is that people don't know they're happening. You're asleep, so you can't feel the warning signs or call for help. Many times, people don't realize they've had a stroke until they wake up in the morning. By then, hours have passed, and the damage to the brain might be permanent. The first few hours after a stroke are the most important for treatment, but if you're asleep, you miss this critical window. Late-night showers feel relaxing and seem harmless, but they're actually putting stress on your body at the worst possible time. Your heart and blood vessels are trying to slow down for sleep, but the hot water forces them to work harder. This creates a conflict in your body that can have serious consequences. Instead of taking these risks, try showering earlier in the evening. This gives your body plenty of time to get back to normal before you go to bed. Your blood pressure can stabilize, your blood vessels can return to their normal size, and your body can properly prepare for sleep. After any shower, drink a full glass of water. This helps replace the water you lost through sweat and keeps your blood thin enough to flow properly through your blood vessels. Good blood flow means your brain gets the oxygen it needs even while you sleep. If you must shower late at night, avoid very hot water. Warm or lukewarm water is much safer because it doesn't cause such dramatic changes in your blood pressure and blood vessels. You'll still feel clean and relaxed, but you won't put your brain at risk.